Now to health matters. Public health experts are raising alarm over the growing health risks posed by mold infestation in homes across the country, calling for urgent preventive measures to ensure safer living environments. Experts say mold thrives in damp and poorly ventilated spaces such as bathrooms, kitchens, basements, and areas with leaking roofs or walls. They warn that prolonged exposure can lead to respiratory problems, trigger allergies, and worsen existing conditions like asthma and bronchitis, particularly among children, the elderly, and people with weakened immune systems. Medical professionals are urging residents to improve ventilation, fix water leaks promptly, and avoid moisture-trapping materials such as carpets in humid areas. They stress that maintaining clean, dry, and well-aired homes is key to protecting public health and preventing long-term complications from indoor mold exposure. We are now joined by a public health practitioner, Dr. Tuyi Mebawondu, for more on this story. Thanks so much, Dr. Mebawondu, for joining us. Now, from a public health standpoint, how serious is the threat posed by mold exposure in Nigerian homes, especially in densely populated areas?
Populated area in every home. This brings to fore the concept of One Health, whereby how you construct your road, your homes, how you maintain your homes has strong bearing on the health outcomes. Now, what are we talking about? You know, molds are fungal in nature. They are produced by fungus who grow on moist area, on moist surfaces. When these things grow, they produce some tiny droplets, or what I would call molds, that can be aerated, that can be inhaled, then that can cause problems, especially in the following areas. They can cause problems in the respiratory system, they can cause problems in the eyes, and even on the skin. Sometimes, when ingested, they can cause problems in the gastrointestinal tract. And what are the natures of this problem? They evoke what we call autoimmune responses or immune responses that can worsen respiratory problem. When you wake up and see people itching their eyes recklessly or they are sneezing recklessly, watch out. It might be a mold in the environment that they inhaled while asleep or that entered their eyes. When you see skin irritations severally affecting people, you have to check the home and be sure that they are not being exposed to mold. When you see someone with asthma or bronchitis having recurrent infections, recurrent attack, please check the home and the food they eat. So it's important. There's a particular black mold that produces mycotoxins. These mycotoxins can cause brain fogginess, can cause confusion, can cause loss of energy, even among people that are healthy. And it's important that we start speaking to this. You've mentioned some of the preventive measures that can be done. That is one. You have to prevent leakages in the roofs. Now we're faced with a lot of substandard materials in the plumbing fixtures in the home. These substandard materials get busted and start leaking. And then, of course, we are faced with substandard plumbers who are not doing good work. When these things happens, of course, mold generally love moist area. They grow there and produce those spores. Those spores then can be aerated, which can be inhaled, touch the skin, touch the eyes, and can be inhaled, leading to those diseases you've mentioned. So we have to go back to proper, plumbing system in the house and fixing leakages. Secondly, we have to systematically at every time, especially during this rainy, humid season, to clean our walls, to pay attention to the walls and make sure they are clean. We have to embrace materials that will be resistant to the growth of these molds. It is vigilance, especially when you have children, when you have the elderly, and when you have people that have allergies to various things, including allergies, allergic diseases like asthma, bronchitis, skin irritations, and sometimes it can lead to actual vomiting. Now, where do we have the dangers? The danger points are the following. When someone starts having recurrent attack of asthma, recurrent attack of itching, that's making life difficult. Somebody can even become foggy in the brain and lose concentration, especially when the person is asleep and just coming from early in the morning. You have to pay attention to the home environment. It's very critical in maintaining people with asthma, it may take people with bronchitis, it may take old people and people with no immune system. It's very critical that you look at the environment where they are sitting, where they are sleeping, and be sure that there's proper aeration. You know, the construction of the homes nowadays, especially where they are overcrowding, can actually aggravate all this problem, leading to excessive growth of mold, not just in the homes or but actually around the homes, where the spores can be dispersed and cause those challenges we're talking about.
All right, Doctor, tell me, are there existing public health policies, or should I say guidelines in Nigeria, addressing especially indoor air quality and even mold prevention?
Indeed, I don't know of anyone. I don't know of any policy, a deliberate government policy. Now, if you're talking about deliberate government policy, you have to talk about the air qualities, even in our cities. You know, now it has become part and parcel of assessment of a clean city that the air quality must be appropriate. If you look at our air qualities, everything is floating in the air. Dust, smokes, hydrocarbons products from cars, people burning woods, everything. It's just in the air. And then our air quality is so terrible that indeed, when you are in cities like Lagos, or even main cities like Abuja, but you tend to fall sick. Once you move to the villages, you get better. This is also because of air quality. The regulation for industrial pollution is being limited by all sorts of things, including lackadaisical attitude from the regulators and even corruption. So nobody seems to be obeying anything. Even in the outside air, that we should have a minimum of a maximum of 15 parts per million of dirt in the environment, we're not maintaining that. In the indoor, those days we used to have what we call the sanitary inspectors, that they come and figure out what's going on in your house. But nowadays, there's nothing like that. Everybody's on its own. And unfortunately, no way to implement any law that assures one proper air qualities outside and indoor.
All right, thank you so much for having this conversation with us.
My pleasure always.